We are a practice dedicated full-time to the care of women affected by breast cancer. We treat women from all over the world, from around the country, with sophisticated operations that allow us to rebuild the breast for women who are seeking risk reduction surgery or reconstruction at the time of mastectomy or even delayed reconstruction. Philosophy. The philosophy is what makes the Center for Restorative Breast Surgery different on a very basic level. The idea originally was to take care of women in the way that we would want our mother, our wife, our sister, our daughter taken care of in a moment of crisis. And the question became, well, how do we do that? What can we add to a very difficult situation that'll make it better? And then the quest became to look for every detail in that regard, to elevate the standard to a different place, not really modeled after anything, to create something new, something that was more than the sum of its parts. The idea was to have a facility and a practice that it wasn't just about surgery and it wasn't just about reconstruction or breast cancer. It was about security and healing and feeling safe and feeling cared for in a difficult time, all those intangibles. And so a lot of what went into the build and the design and the staffing and the way we handle our clients, I like to refer to them more as clients than patients even, because we want to elevate that relationship to a different place. And that, to be honest with you, it requires a lot of work and a lot of intentional effort in that regard. It's difficult for that just to happen organically, but with a lot of attention to detail, it's very possible, and the payoff has been better care for women who need reconstruction in and around the time of breast cancer or at the point where they're seeking a risk reduction surgery or the correction of a previous result that didn't work out. In the first moment, it's probably surreal, not having suffered a diagnosis even close to that. The first moment is that surreal moment of disbelief. It's an error in the paperwork. It's dialed the wrong phone number. Not me. I don't have time for this. I've got little kids. I've got a career. So in the moment that someone's diagnosed, it's difficult to process the information. So they have a visit with their imaging center or the breast cancer doctor that they're referred to. And in all likelihood, it's probably fairly ethereal in their minds, very clouded. And then there's a moment of implosion of your normal world. The facing of your own mortality and the worry for disfigurement, worry for chemotherapy, losing your hair, what's going to happen to my family, what about my husband, who's going to take care of my children, all that crashes in. And so in most cases, my guess is that women then go into a mode of sort of following whatever they're told without much question because it's too much to process. And so almost becomes a passive event rather than something that you're in a position of strength to take charge of. And that's a vulnerable situation. That's a vulnerable moment. And what we need to do now in this information age with organizations like I'm Taking Charge is to change that dynamic a little bit. Because in that moment, you need to have a little bit of power. You can't be totally passive because you risk the possibility that the choices being made for you might or might not ultimately be in your best interest or lead to the best outcome or be in the best place or whatever. It's always very important to question everything. Not that you're going to have bad treatment or that people don't have your best interest at heart, But if you don't have knowledge, if you don't have some kind of resource that you can go to that's simple and concise and speaks in clear, real-world terms, it becomes a tornado around a moment of chaos where the information then becomes the problem. There's too much of it. It's coming from 8 different directions. My neighbor said this. My other doctor said that. I heard about this on the internet. I saw a TV show about that. It's almost impossible to process. And so what happens in the moment where someone's diagnosed? My estimate is a summation of all of those things. And most of the time things work out well, but sometimes they don't. Most people are good and generous and giving by nature, and women in particular. There is very likely a selfless moment, a self-deprecating moment where, how can I possibly consider traveling for breast reconstruction when my husband's been laid off of work and my kids are lack for some of the things that they need or want. How can I be so selfish as to go and get on a plane and go seek care at a high-level center? I just kind of need to just take one for the team. Mm-hmm. So yeah, I think that happens with some frequency. I think the giving, selfless idea behind that is a high quality thing. But this is high stakes. The decisions that are made in that moment live with you forever. They live with you for the rest of your life. They impact you permanently. In as much as the breast cancer is very serious, and any kind of surgery is very serious, time heals all wounds eventually, so it's only a moment in your life, and if you make carefully guided, information-based decisions that say, yeah, we may need to kind of take a little detour away from where we were in the beginning relative to the advice we were getting, because I think there's something better over here, and I vetted it out, and I'm quite confident that 5-10 years from now I'll be very happy that I took that extra trouble or extra expense or extra time to make a decision of that type. Most people are thinking persons, and they can process information. And if it's delivered to them in clear terms, if you speak to them like they're your neighbor or they're your wife or your mother, they'll get it. It's not rocket science, not Stephen Hawking. It's not astrophysics. If you break it down into its simplest common denominators, most people get it. And most people are very okay with, yeah, I realize it may not be perfect. I realize there may need to be little adjustments. I realize it won't be the way it was before, but it can still be very beautiful. And in some cases, it can be even more beautiful. If that discourse is had with honesty and integrity, I don't think unrealistic expectations even come into the mix. If you're not communicating well to your patient, sure, there are probably unrealistic expectations based on inadequate information that they've gotten from who knows where. Mm-hmm. And the other side of the question with respect to it being loaded is realistic expectations should be that in the year 2016, with all the technology that we have, we ought to be at a point where we can rebuild a breast and make it beautiful. It's not unrealistic. And if instead they get a disaster or a scarified result that is so far away from what they understood was possible in modern medicine, that's an unrealistic expectation that didn't need to be. So unrealistic expectations that's deeper than the surface level of the question, and it's a good question. there are different categories of women affected by all of this. We talked a minute about the immediate reconstruction scenario, the mastectomy time, the breast cancer time. And that carries all the thoughts that we were talking about a few minutes ago. And then there are the delayed reconstruction patients who've had mastectomy in the past and have sort of lived with the face of injury in the mirror every day when they're getting dressed, and the incessant reminders of that dark time, whether it was a year ago or 5 years ago or 25 years ago. Those are delayed reconstruction patients. Mastectomy is done. Empty chest, blank slate. They come in for treatment. And those are the women that have a very glorious experience with breast reconstruction, because it's all upside at that point. Whatever we're doing on the day we take care of them is better than where they started when we shook hands on the first meeting. And then the other category, two more categories actually. The other category are women who with BRCA positivity or other risk factors that make them at high risk for developing breast cancer at some point in their life, but today they're perfectly healthy. They have a perfectly healthy body, no breast cancer. And they're battling with a decision about what to do with an extreme likelihood that at some point in the near future or distant future, they're going to have to deal with breast cancer. And it could be wildly advanced. It could be early, but who knows? And if there's an opportunity to take the risk down to below the general population with a procedure that removes the breast tissue and rebuilds things in a beautiful, elegant way, those women do very well. If someone's seeking a prophylactic or preventive mastectomy with an absolutely healthy body, and they have a devastating complication or a bad mastectomy or a bad reconstruction, there's a lot of regret that goes with that never goes away. Final category of patient. And this represents about half of my practice on a day-to-day basis at the Center for Restorative Breast Surgery. And those are the women who've had, excuse the word, a botched surgery in the past and now come in for an effort at fixing it. And it's not uncommon for these women to have undergone 3, 4, 5, 6, sometimes more operations over a decade in an effort to remove that face of injury, to give back wholeness, to rebuild their bodies, to get back that sense of self that was lost in that whole menagerie. And those are the women that I have a special passion for, because very often the situation that they're in may have been avoidable with some very simple changes on the front end or some very different planning. You know, doctors don't even know all of what's possible. And so you have to do your own homework. You have to empower yourself. Yeah, you're probably getting good care and good advice, but doggone it, double check. How much time do we spend comparing and contrasting the car we're going to buy? You dig through the internet, you want to know about the crash history, you want to get the blue book, you want to go visit 5 or 6 dealerships, really? Are you vetting out your breast cancer surgery and reconstruction with that level of scrutiny? If you're not, why not? Because rebuilding something that didn't have to be it's a little heartbreaking, but it's also very rewarding on my end. If I can meet someone who finds themselves in a situation that for years has seemed just completely hopeless. I've tried every bit of advice. I've stayed to the letter of the post-care instructions. I've done everything, and they have overt disfigurement, not just a little scar that's not right or one side isn't the same size as the other. If they have overt, devastating disfigurement, and you can do something about it and you can fix it, that's a big deal.
This presentation is made possible through the support of Air Expanders and the Center for Restorative Breast Surgery in New Orleans. For more information, go to I'mTakingCharge.com.